been with Parmarth for almost 6-7 years. See, this is our body itself. How many of you experience pain? We're going to take a deep breath. A lot of anxiety is there. This area becomes really, move it to the spine. Or we're analyzing too much. This area, the energy just gets. The stress. And when you don't stress, you look younger. The breath is everything. You don't need to be upside down. Any of the brain trauma child, I have to individually test them. You see Shiva always in a meditative position. So welcome to Parmarth, and I've been with Parmarth for almost 6-7 years that I've been taking seminars. Every International Yoga Festival I'm there. And thanks to Swamiji and Sadhviji that I get this opportunity to speak to you guys. Where are you guys from?
I'm originally from Brazil,
New York City. And you're from originally?
Originally from Japan.
Japan. Wow. And you? In Miami. Spain. Now, I want to introduce myself. I'm Dr. Nishi Bhatt. I grew up in London and I did occupational therapy in London itself. And then I started working with children with brain traumas. So when we say brain trauma, we just normally think that it is just straight away coma. So that's not what it is. Brain traumas can result into any diseases in our body. Majority of the time, what happens is that when it happens at prenatal, right? So when the lady is pregnant and then the genetic defect starts coming in. So when that happens, there is a trauma which comes as a prenatal trauma. And I specialize in that. So what we worked in before, we started doing occupational sensory therapies that we did before. And it didn't bring the results that we were expecting. They were very minor changes. And how many of you guys are in healthcare? So you must have realized that doing occupational therapy is very limited in bringing results when it comes down to children from just born to at least 5-6 years old. By that time, the brain has already been formed and the structure of the bone has already been pushed into a position where they can't grow. Right? And that when that happens, it becomes microcephaly, which means that the brain stays smaller. Okay? So it's very, very important that the children, they get the right therapy when they're born straight away. See, this is our body itself can create those cells. We do not need to take it from outside if the right breathing takes place, right? So this is what I'm going to teach you today, is to how to create certain cells which are naturally produced in our body. So you don't have to go and take chemicals. They are synthetic chemicals. They're not going to, no matter how much realistic it becomes, they are not something from your own body. That is an outside entity. So it's a well-known fact, and there are a lot of studies that has taken place where the medications and vaccinations have had different effect than what was expected, right? So when I do the treatment on a child that is probably 1 month old, 2 months old, you can't really do breathing, can you? How do you ask a 2-month-old baby, take the breath in from the right and breathe out from the left? I don't think they're going to hear you, right? So how do you make a child start taking breath in from the nostrils that we want them to take? So this can apply to patients who are in coma as well. Okay, because there's no movement in coma as well. So any of the brain traumas where the paralysis has taken place, so you also have Bell palsy, which affects one part of the face, and you cannot make movements that easily from the nostrils. That's how you breathe in, right? Parkinson's is another thing. Brain stroke is another thing. So again, everywhere where there is a motor neuron involved, which is majority of our actions, right? So how do we activate that? How do we let the right brain and the left brain still function after the trauma has taken place? Any answers? I mean, I'm sure you guys have been attending yoga classes from few places around the world. So any of them who can share, how would you make a coma person, 2-month-old baby, or any person in brain trauma to perform the right nostrils and the left nostril breathing? So it is not the 90 minutes. It depends what the function, because as an adult, our time is different compared to a baby, right? So the baby breathing is much more faster than a normal person like our age, or even the teenagers, they breathe faster, okay? Compared to as we get older, our breathing becomes more steadier, depending on the health, though, of course. So when we are working with a child, what we generally do is we lift their one hand. So if I want to activate this part, now we're going to take a deep breath and move it to the spine. So imagine when you're breathing in, make sure your stomach comes out. So when you breathe in, the stomach is out, and fill it up towards your spine as well. Take a long breath so we can count till 4. So 1, 2, 3, 4, 5, and 6. Now we have to breathe out. So when we're breathing out, take out all the air from the stomach. So your stomach will shrink completely, along with your belly button, in your own pace. Sometimes 2 nostrils are active at the same time, right? So this is the Pingolini ones, where you would find that, okay, there's 2 nostrils. Before it changes to the right or left, the 2 of them are active both at the same time. So don't be confused. If it is you are in that phase, stay in that phase. We're not going to force it, okay? The reason why I'm asking you to first understand your breath is only because you know which area of your brain is active, okay? So when you are on your right side of the breathing, in our sciences, what we say is that if your right is active, that means any work that you go out to do will be successful, right? Why is that? That is the belief system of a lot of Ayurvedic books that you'd read. They say that, if you have the right nostril breathing, then you can walk out of the door and you'll accomplish anything that you want. Okay? And when it is the left nostril which is active, you need to be more silent. You should be doing more creative work and not analytical work where it needs a lot of data analysis or anything like that, where it needs complete concentration, right? So that's when you will see that your creative side becomes active. So when a child is born with a trauma, you will always find that a part of the brain, or even the adults who have had trauma, a part of the brain which is affected. So it includes depression, it includes, any neurodivergent child that you work with or adult that you work with. I'm talking about majority of the time, their right nostrils is more active than the left one. Okay, so that's why if you look at an autistic child, you will always find them much more focused into the task that they take. And if somebody tries to divert that, they have a very aggressive output towards that. That's because their constant right side is more active than the left. So the calming effect is not happening to the brain, and neither can they communicate to each other. And I'm talking about the right brain and the left brain. So even the communication of the child is affected, because you cannot be analytical without being creative. You have to take the creative side along with your analysis that you take place in observing the ground. So if I'm today looking at the corners of this room and I'm looking at people, it helps me to decide, how do I want to take this class, right? So I have to work with my creative efforts and then put into practice what I want to teach you. So that we don't have to tell our brain that normally. But if you have a trauma, you will probably have to tell yourself that I need to do this now. But generally it happens naturally to majority of the people. So we'll do these exercise now. So we did the breathing. Okay, so now 12 people were having their right nostril active, and then I guess the rest of them still guessing which one it is. So that's fine. So if we are working with a person with epilepsy, does anybody know what epilepsy is? Oh, okay. So epilepsy is basically when a child is born with some defect in the brain where during the birth the oxygen did not reach the part of the brain, and it has created kind of like an area where there is no blood circulation, or there is no food that is going to that area. There is no energy that is given out of it. It is almost like a black hole. It's just created, and nobody knows what's really happening in there. There's no information that is grabbed into that area, and suddenly the child will start having seizures. And seizures, basically, you must have seen people who just fall down suddenly and start having white foam out of their mouth, or sometimes it's just tightening of the full body, where they're not functional at all. So it becomes spastic. Spastic is where they can't move anything, not even one finger. Neither in their eyes are completely, eyeballs are going in the center, towards the center of the brain, right? So sometimes people show those kind of children like as if being possessed, but they're not possessed, they're actually having a seizure attack. Okay, so it's very easy to help them out. If you see a child, you have to press this point right in the middle. So this connects to the occipital brain, right? So this is the center nerve. So this is like a switch for our brain. Okay, so even if you're having a panic attack anytime, you just press this part. Press it. You will feel. No, in the middle part. Can you show? Anybody confused? So it's the middle part, where we have this this one is fine. If you're doing it on yourself, then the thumb is good. But if it is a child, then it might helpful to use a little, because you don't have to press too hard for the child, because otherwise the bone can break around there. So you just have to press a little bit harder and give a support over here, and then press it. Okay, so that will help to release the spastic attack that is happening around the face. Okay, so brain, that's why they say never hit a child on the face or in the back of the head, because this part is like a little brain, right? So that's why they say don't hit across, because this nerve, all of these nerves, they affect the eyes, the speech, the hearing. But worst of all is that it can create a hypoxic brain as well. Okay, so we have to be very careful how we, punish a child. There are many different ways rather than hitting somebody. So this part, like I said, is for Caesars. I think you should all write it down, because you never know who you meet. And suddenly you find that there's a man who's just completely on the floor and tightening their body, or having something coming out of their mouth. So you can always try. If you see somebody, you can always help, and you should help, right? Second point that we work with is the point over here. Okay, so again, this is in a lot of, when you study chakras, you must know what is this point. Agya chakra. Third eye, yes. So why would we press the third eye? So when we press this part, okay, again, this is connected to frontal and parietal lobe. Okay, and this affects the speech, okay, and also the eyes. So if you see somebody, they may have an eye, that one eye might be coming to the center, not completely squint. Yeah, what is squint? Do you know what squint is? Squint is when both eyes are right in the center of over here. So the eyes comes in the middle. And what the doctors would normally say, that you need to have an operation. Okay? But it's not necessary to have an operation. You can correct it through having certain pressures that we can put on the forehead that can completely change the vision of the child without having an operation. Okay? And I have seen 50,000 children so far, and I have had tests done for VEP test, which is the test for the eyes, which proves that is the child going blind because of the nerve degeneration. And in 3 months, when they're coming back, they don't have that. Okay, so things do change, and the results come really fast. So it's not necessary that you will have to have an operation for a squint eye. Okay, or the blindness. A lot of children are going towards blindness nowadays because of the TV and the graphics that they see on the phones. So what happens is suddenly their eyes are getting dry, and the eyes are coming in the center. So what we do is first we press this part, okay, and then we press this part in the middle. Yes. So you would see a lot of Indian women put bindi over here, right? A lot of them will put it here, but it's actually the third eye is here and not here. Yeah? So you press it here. How many of you experience pain? You do. Do you have glasses?
Yep, I'm very good.
Yes. So normally any person who have had glasses, it means that the eyesight is weaker, right? So over here, there's a nerve, again, which is controlled towards the frontal area, okay, and occipital area. So what you see is straining your eyes, and when you put that pressure here, where all that energy is there, built up, and it is blocked, so you feel the pain there. And pain, it's something where we do it every day. It releases that energy, and you will start seeing the change in your the glasses. If normally what happens is that once you wear glasses, then the numbers always increase. They don't decrease, right? But if you practice this on your child, or even if you practice it on yourself, you will see that there is a difference, but the difference is better. That you won't, the number does not increase, it goes down.
And it's like I have far sight. So they say after like 30s or 40s, then everybody will have reading glasses also. So I am too scared that after 40, I will also have that. What do I do so that I only have far sight? I don't want to wear double.
We will work on that. See, if you look at the page that I have given you guys, the booklet, I have given you few points to do. Just look on which page is it? 6th. If you go to the page 6th, yeah, these are some everyday points that you can practice, right? So these, basically what I've given right now is only for the brain. I've not touched the whole body. So the brain is the whole body, but that's another topic. But yes, so when you are doing that, it releases a lot of your blocked energies. And if you do this on everyday basis, any problem with depressions, anxiety, panic attack, seizures, all of this, and even sometimes what happens is if you see a person with Parkinson's, this becomes tight, this area, or if they are in serious depression or a lot of anxieties there, this area becomes really tight. So even if you want to check, just press. Can you see this area? Just behind the earlobe here. Normally, normal people who are not practicing what she's practicing, they would feel a stiffness around that area. Why? Because when we are thinking too much or we are analyzing too much, this area, the energy just gets stuck. And that's why the pain is not released until you press the areas which are right behind the ears. Yeah. So how I would ask you to do is just press it for like 5 seconds. Some must feel like really, really numb and painful. You can do this every day. And then release. Hold for 5 seconds and release. Right? So when you start doing that slowly, you will release the energy which is there between the teeth. Am I right? So when you start doing that, a lot of times you will see yourself. Another thing that happens good is you have a natural facelift. So anybody who's taking Botox won't need it after this one. So you just have to press that. So you're just pulling this muscle up and then you're pressing it. And then release. So again, pressing it and release.
And will this work for like when the babies are teething?
Yes.
Okay, so
Yes.
that's right.
Again, because they clinch. They clinch really hard, right? So that is something anywhere, any person that you see. Sometimes people have this habit of, clenching the teeth, right? When they're getting angry. Is if somebody's having high blood pressure. How many of you suffer from high blood pressure? No one?
My
All
mom.
yogis. Yogis have the highest high blood pressure rates because they're trying to prove they're yogis. That is the hardest part to play, right? You just have to, sometimes what happens is that when you clench your teeth, you also stressing on your skull, this area. So slowly you will see degeneration of your eyes, your taste, your every sensation, sensory activities decreases. But if you start doing this, it's much better than Botox and fillers. Trust me, because it's a natural way of releasing the stress. And when you don't stress, you look younger. You just hit. Okay, 60 times. Here, just here. In the middle. So you do, and you do it 60 times and do 3 rounds. Don't overdo it. Okay? Second part, just where we pressed hard, I want you to take 2 fingers and you rub up. 1, 2, 3, 4. If you can't see, let me do it here. 1, 2, 3, 4, 5. So you do it 60 times. Take oil. Just don't do it without oil or talcum because you don't want rashes over here. What we have, our body is energy system, right? Now, what are diseases? Aging is a disease, right? If you see, it's some of the yogis who don't come in public and they're mostly in the mountains, or the monks who are staying within the monasteries, you would see them live up to 130, 140, 150. There is no age. You would not know their age. Sometimes they don't even remember when they're born, right? So aging is a disease. And the way that we live our lifestyle and how we exchange energy, in the way we speak, in the way we see, in the way we hear, dominates how the energy flows. Right? And that is why the children of today's generation are not as healthy as what our last generation was. Right? Because our last generation saw war. They saw famine. So when they have seen those things, it's a trauma that is passed on into the DNA. And that is a memory. There has been research where an army general their DNA was taken and they went to the war. And when they're having hard time over there, their DNA danced in a different manner. So even though that DNA was removed from the body, it still was connected to the emotion of the general. And there are studies that has taken place on the DNA and manipulation of DNA. So when we are thinking that I am not well, you will not be well. And if I tell the child who has been stuck with this autism, it is so easy these days to just say, okay, he's autistic. It's so easy to be labeled as ADHD. Oh, he has ADHD. He's not listening. He's hyperactive, but with psychological tests that are done today. You have to get an MRI done. You have to have blood tests. You have to have certain genetic tests that should be done before any child is labeled as any neurodegenerative disease or defects. You cannot just label somebody. And that is what I want, when you leave this room, at least one thing I want a promise from you guys is don't take the labels seriously. There's nothing in the way that you can't change about yourself. There's nothing permanent. You are not depressed for the rest of your life. Depression can be changed. If you're working towards changing that, you believe that you're changing the belief system, you change everything, how your brain performs.
So what would you see in an MRI for a child with autism that's different?
Yes, so this is a good question. When somebody is highly on the highest spectrum, what happens is you will find that the brain, the area of the brain, which is the cerebellum area, you will find it little smaller. And the synapse system, which is there, so normally a synapse system will have one big branch and another second branch. With autistic child, you will find that they have multiple branches on that synapse system. Okay, so it's like if you look at the synapse into the MRI, you won't be able to see that. It's normally a specialized test that is taken place, but you will see that, okay, the part of the brain is smaller and the other part of the brain will be larger. We come back to the question of what's with the left. Okay, so left is like, I did touch the part where the left is the creative side, okay? And I didn't ask, yes, I agree, but I did touch on what happens on the left breathing. Yes, so we're putting things together at the end. I know you're in a rush, but so there are things, see, I'm taking this session not so that you just take some points and you go home and you're just looking at the notes that you have created and that's it. You know, I want you to take something with you which you're doing practically. And today you may not see that many neurodivergent children, but tomorrow you will. Okay, because the next big diseases that are coming is neuro. Okay, and that's why I'm preparing you guys, because you all have come from different parts of the world, and it's very important to know that the natural sciences, the yoga and everything else that we're learning, even there are Balinese massages and the treatments that do take place where you start breathing again in a better way. So it is not just India, there's all around the world, there's this energy which is shifting towards natural resources. Why? Because when there is little of something, it wants to expand. So now that the natural resources are coming to an extent, you will see that it is attracting more. And the war is going to start to get these natural resources. Okay? But the best natural resources we have is our brain. Okay, and don't let anybody take that. So coming to the left and the right breathing thing. Any questions? I mean, you were asking before I go into that.
I have lots of questions, but I can't ask them all right now. I work with autism all the time.
Oh, I love that. I'll have to learn a lot from you then. So when we are doing right breathing, we want to start the right breathing. So say you want to teach maths that day, or you have a monthly statement in front of you and you want to analyze. Because it's become difficult when you have a left nostril active, you will not be able to focus. Right? So what do is you start your right nose breathing. So how you would do that is, this is my right brain. Okay? So normally you would think, oh, right brain, right hand. Okay. No. It's always the opposite. So you lift up your left hand. Do you want to do that? And close your eyes. Let's experience this. I think this would be fun. Close your eyes. Left hand देखना. Good. Start breathing in. And put your one finger near your nostril. And slowly see your breath shifting from both nostril to one dominant nostril. Can you feel? Which nostril is it? Right?
What is the science behind it?
Science.
Connecting the head with the, because I've noticed that
Okay, let me first, 1 second. Let's focus on how many had the left active and the right active. Just say when you pick up your hand, which nostril was active? Yes, perfect. Okay, the more you will understand, the more you get your energy together. Okay, so the first should be aligning your breath. So, say sometimes you just close the door, you're doing some activity before you want to sit down and meditate, or when you want to align your breath. The first thing you need to do is sit. Don't do it when you're standing, not like me when I'm giving you this, information. It should be mostly sit in the place, get yourself aligned by just observing your breath. At that moment, we're not doing anything. So if you're working with child with autism, the best thing to do is bring in music. Okay? So when you bring in a slow music, suddenly their breath, somehow I have seen that humans, we are affected by the music a lot more than we thought. So when we have certain sound frequencies, then because it's such a vast knowledge, I can't give you in this 1 hour session. But so bring your whole energy together and then first just observe what is dominant, what is at the moment, what is active. Once you understand, okay, this is active and I want to move out of the house and I want to work, because you work in a banking industry or you work as a creative artist where you have to do graphics. So again, left, you want a left nostril active when you are going to work if you're in a creative industry or even acting, right? Anywhere where you have to express yourself. See, dancing is very different. I tell you why. But if you are designing the choreography, then you can, right? So dancing, we don't do dance to create work. We dance to express ourselves, right? Majority of the dancing is about expression. So, yes. And a lot of cardio work is going on, so you cannot control at that time. But say if you are, what I mean by creative is that being intuitive to innovate something new. That's what I meant. So if you're doing physical, it doesn't matter right or left, but majority of the time right should be active. If you're going into some dancing sessions, then it would help. Okay, so align yourself, whatever is active and what you want to make active. So this one is, what did we learn? Left activates the right. And so what would the right do? Left. Okay, and if you put both, do you want to experience that? Go on. Close your eyes. And make sure your hands are straight. Yes. Not one. It's both are active. So again, you can bring your body or you bring your breathing according to the way you work. And that's what yogis used to do. I've just given you like 4,000, 5,000 year old secret of how to activate which part of the brain. You must have seen in most of the yoga, or if you see yogis, they have this thing like the one which has like a wooden thing. What do you think it was for? It wasn't for like putting his hand on there, because he needs a right brain active when he is trying to improve his meditation techniques. So when he's want to increase his energy, he uses the right brain. Okay, so that's how you would see most of them on the right. So they would be activating the left, right? And then the left, he would be activating sorry. Yes. So I always ask the questions to people. Have you ever seen Buddha in any of the yogic positions? If you have, please share that picture with me. Have you seen him? Pani dena? Sorry. Sure? Majority of time it's over here, because this part, again, we give a lot of treatment in this area. So this area again is covered with this one, and this one. It is all the part of the brain that when we put the pressure on this area, straight away you're controlling the breath. MRI, when I see the MRI, I will know if the hypoxic injury is on the right side of the brain. I will know where to penetrate my needles to get results. So I'm also a doctor of Oriental medicines and acupuncture. So I work with a lot of acupuncture when I'm healing the brain as well. And we see the effects straight away. Right? So I would ask you to just press this part. So any person a lot of you must have, the whole part of the area which you cannot move, the shoulder, right? And it's got nothing to do with the shoulder. It's got to do with the arm. So there's a stiffness in your arm that creates the stiffness in the shoulder. So when you're writing down, when you are on the phone constantly, so this meridian, it goes all the way to the top and then it goes to the heart. Right? So we've learned about the right, left, how to control. Any questions so far? So left activates the right brain, and the right hand up will activate the left brain.
When I did one side, it was still the same.
Yeah. See, that's what I'm saying. Sometimes when you are very active at the moment because you're focusing on too many things. So some people are able to straight away come to, the stabilization. Some bodies take time. So that's why I said always first sit in one place, get yourself aligned, and take few normal breathing. Just do the normal breath. Observe your breath. And once you observe the breath, straight away you will calm down, and then you can do the right and the left, and you can do it at work as well. Once you learn to control, once you understand, then you can do it quickly. It doesn't take that much time. So it's like normally what I do is if I'm walking out of the house, I will always check which nostril of mine is active, and then I'll walk out of the house. If it's right and I have to go to the bank, I will always have the right. And if I'm having an art class, left.
Hello, everyone.
Can you hear him?
Yeah. This is a personal question because I come from Prayagraj, from the Kumbh.
Kumbh Mela.
Yes.
Oh, wow.
I dipped in the Ganga there. It was an amazing experience, but when I came here, I get sick.
You got sick.
Yeah.
Everybody did.
Yeah.
Yes.
So it's not so personal maybe for many people. But the thing is that when I am like this, I can breathe perfectly. But when I got in this position, my nasals obstruct totally.
Okay, so for that, this is very good actually, because you will face viruses, you will face a lot of breathing issues, because when the weather changes, so where he went in Kumbh, it's really hot and humid at the same time, and then at night it's really cold. Right? So when there's a difference of temperature that happens, it's very easy for our body to catch cold and have viruses, that enters into our body, because Mela is not something for faint-hearted. There were like 65 crore people there. So you literally you just basically hear and that the person is right on your face, right? So you will be exchanging a lot of fluids whether you like it or not. Okay, so when that happens, the virus multiplies faster. So how do you stop that? Okay, so your question about the breath, that you're not able to breathe in very easily. Yes. Yes. So this point, just beside your nose, the opening. You breathe in, press it really hard because you will have to enter into the fourth layer. So you just have to press. And I do this with children who have bronchitis. And you press it really hard and it's taking in the breath. Can you tell me how you feel? Do you want to lie down? Put your feet on the ground. Yes, good. Press really hard. Are you able to breathe? Better? Right now, if you keep doing this, I'm sure you'll be able to. And slowly you won't have to do it. At least practice it for 3 days. But you're able to breathe better, right?
Yeah.
Right? A practical example right in front of you. Thank you. Right? Imagine how many people are able to, having, a lot of bulgum in the chest, especially with children. So you press this part and the child is able to, you don't have to nebulize the child.
So at the beginning you talked about our bodies can create something naturally to avoid taking pills or chemicals. And so are you saying the breath will create chemicals?
Different kind of breath. See, we are not just, we don't just take one cycle of breath. There are infinite, I would say so far what we have discussed is about 300 to 400 different type of breathing that takes place. And our different organs of our body, they have a different breathing style. So I don't know how many of you have had yoga masters in yoga? You have. Anyone else? You have. Masters in yoga? Did you do BSc?
I facilitate breath work.
Okay. So when we are talking about lung breathing, it is a different form of breathing. So you will breathe out of the mouth, not from the nose.
So what are the things you're talking about that would help depression and anxiety?
So the one that I told you about, one is breath work, one are the points that I have shared in this booklet. Okay? Do that. These are all inclusive because mainly my specialization is brain traumas. So I try to concentrate mostly, and whatever I've given you on there is related to releasing the healthy cells that are required, and the rejuvenation of the cells becomes healthier when you do these points. See, one thing is, if your breath is regulated, if your sleep is regulated, the sleep does not get regulated unless your breath is regulated. Okay? And once that is regulated, your sleep will be regulated and then the brain healing becomes faster. I know neurosurgeons who say, oh, the brain never develops. Once it is damaged, it never develops. And I have proved them wrong again and again by doing an MRI before and after of the child. I have increased the size of the brain where the doctors say you can never increase the size of the brain. I have increased 7 centimeters of a child that was microcephaly, which if you ask any researchers, they will say, oh, that's not possible. And I have showed it in MRI. I have showed it in the size that we take every time they come after every 3 months to me. So there is nothing in our body that cannot be regenerated. It's only how you breathe and what rhythm of your body is maintained to the breath work. When I was talking about Buddha, we have Shiva. When you go to the Ganga, River Ganga, you see Shiva always in a meditative position, right? You see Buddha always in a meditative position. Why? Because breath is everything. You don't need to be upside down. Yeah? When we do exercise as a yoga, the stretches, what it does, it gives the oxygen to different areas of the muscles, the oxygen that is needed to regenerate. right? But if you have already mastered the breath, you won't have to get into any position. But he used to walk. He used to only eat what he used to get when he asked for bhiksha, which is asking. He would not buy his own food. You only have to eat what is given by people. So again, the food intake was limited, right? So we don't overindulge into eating food, walking, and breath work. These three things. You don't even need sleep. If you mastered these three things, a lot of gurus who are actually looking younger and younger, they sleep very less. They only sleep for 3 hours, sometimes not even that. So we only sleep because our energy is depleted. But if you learn how to hold on to the energy through breath work, you don't even need to sleep.
So, do you have research and literature pertaining autistic kids and, let's say, a 5.5-year-old unable to talk and speech, and the parents have given hope that he'll ever talk?
So I have a channel which is followed by almost 3 million viewers on YouTube. So I've got QR codes outside, so you can just follow me, and you will see practical work being happening, and you will see parents talking about their experience, how the therapy has completely changed.
With especially autistic kids?
Yes, and the literature does not fall for every person in the same way, because it depends on what spectrum they are. Again, along with brain defects as well, you cannot have one consistent therapy. So it is very personalized when it comes down to, because when we check your pulses, when we are checking the meridians, what we realized is that every individual has their fingerprints, which is individual to them, same is the rhythm. So you might have a very different rhythm to your husband. Just because you're staying together for 25 years doesn't mean that you will have the same things, right? So when you have a child who has autism, but autism is also different. It's not, I'm sure you can always speak to the lady who works with children with autism. But this is a good networking, I think, because there's so much to learn in this place, that also understanding very few people have understanding of what neurodivergent kids are. And they just go by what media shows them. They just define what a disease is. And it's not that simple. So we need to understand, and anybody who's interested should connect with each other to know what is happening in this world, because somebody who's working practically in that field might be able to, if you want to work in that field, because there's a huge space out there. So learn about more in depth of how the brain is affected. That is very important. What food creates an energy at what frequency? Every food has its own frequency. So if you are having grain, which is heavy grain, humid grain, right? That will create more dampness. That will create more, phlegm in your body. So we just eat things, we just think, I'm very hungry, so I'm going to eat biscuits. But what are biscuits? Which grain the biscuits are made of? It is made of wheat. The modern wheat are not the real wheat that you guys eat. A lot of pesticides are used to increase the size of the wheat. The real wheat are very small. And when I came from London, I didn't even know what wheat looked like, because I only used to buy flour. So we don't know what wheat or what size of the wheat and, how to eat that. But the more you research, you understand that the organic things will never be too big. It will be smaller in sizes. And that's organic. If it is hybrid, you'll be like, oh wow, this is so tasty, so sweet, the watermelon is amazing, but you don't know that it's been injected with something that makes it sweeter. Right? So again, what you eat is what will create your emotions, and those emotions will create a healthy person or a diseased person. Okay, so I have a second session which is on the 15th, just after the Holi, right? But it's in the morning, so you guys will have to get up a little early who wants to join. And also, yes?
So not to interrupt you.
Yeah.
The question you asked early on, or maybe I may have missed, if a person is in coma, unable to breathe, and you want to start the breathing process,
no, then you have to see, coma is a state which you can't just press things and just work. So what I've given you is just a little highlight of what can be done. And one of the biggest examples of him who was not able to breathe, he was able to do. So that's a practical of knowing that yes, it works. But there is a system. So you will have an individual has to come to me to know, so I will do some test for them, even if it's a coma, Parkinson's. So we do a test, and then those results will tell me what frequency their body is working in. Is it getting lower or is it getting higher? So then we'll include certain points in the way that it is being kind of streamlined, and you will have to do that every day. Same thing for the child. So even if you bring an autistic person or any of the brain trauma child, I have to individually test them. That's why I am very scared sometimes to put my work out there, because a lot of times they say, oh, ma'am, just put the, therapy out there. But sometimes where the child is not that active and you start pressing those points, which is supposed to, calm them down, it works opposite. Right? So individual plans, individual therapies are very important. Thank you.